Thank you.
Well, good afternoon. Welcome to this week's episode of Monday Biz Motivation with the Culver City Chamber Ambassadors. I am Candance Simmons, owner of All That and More Boutique and the chair ambassador. I get the opportunity to host with my amazing co-host, Rafia Cooper of Rafia's collection. I want to say jewelry collection every time, but it's Rafia's collection. And she is also an ambassador. And the Culver City Chamber, one of its missions is to be a connector of ideas, resources, and people. So this platform was an idea that was created to introduce you to some of our amazing business owners here in Culver City so that you can find out who they are, what they do, and how they serve the amazing community of Culver City. So with that, I'm going to turn it over to Rafia because today you get not one, not two, but three ambassadors for the Culver City Chamber. But I will let Rafia introduce our hosts. Take it over, Rafia.
Thank you, Candance. So I'm happy to be here today. And like Candance said, we have three ambassadors here with us today. And we have Eric Carr, who is a fellow ambassador, as well as owner of Home Instead Senior Care. So welcome, Eric, to our little Monday Biz Motivation show.
Oh, I'm really, really happy to be here. Thanks for inviting me.
Good to see you, especially since we can't see each other in person. It's good to see you in virtually.
Yes, we're all getting so used to this. So
we are. We are. So tell me a little bit about your business and how long you've been in this business.
Well, Home Instead Senior Care is a non-medical care provider. So what we do is we help people exercise their choice to age in place. So their home becomes the environment where they receive care from us. So some of our clients will have a caregiver from Home Instead come and help them a couple times a week with things like errands or things that maybe they just need a little bit of help. And other people will use our service round the clock. Maybe they need support with every hour of their day-to-day activity, including nighttime. So it's a very customizable service that we do, and it gives people the power of choice to stay home and have care come to them rather than having to feel like they only have the choice to move out or move into an assisted living or into a nursing home environment. They can actually receive care at home.
Wonderful. So how long have you been doing this?
I own Home Instead with my business partner, Diane Green. Diane's an RN, and we opened our doors. It was the spring of 2013. So we're coming up on 8 years.
Wow. Wow, that's amazing. So go ahead.
The name Home Instead. I remember meeting you at one of the mixers, Eric, and we talked at first after I said, you look like Superman. And then I was trying to figure out your business, Home Instead. I was like, he's Clark Kent. You have to be Clark Kent. So now in my mind, you're like the Clark Kent of senior care.
Can you see me blushing through Zoom?
Great. Because you did that in person too. And I was like, tell me more. Home Instead, the name, is that like a franchise name? Because you said you've owned it for 8 years.
Yeah.
So can you tell me a little bit more about the name? Because it seems to speak to what you do. But Home Instead, I was trying to figure it out, like home instead of moving to a hospital. Is that the concept?
Exactly. So the idea of the name Home Instead speaks to what I, kind of what I was just explaining. Like, back in the 90s, home care, as we've all come to know, it didn't even exist. It wasn't until the mid to late 90s and early 2000s that home care companies like Home Instead started to become the norm. It became a recognized, well-known choice for people about how to get the care that they needed as they they got older, or not even just older, just maybe because they had needs that they needed to have at any age attended to. So the concept or the name of Home Instead speaks to choice. Home instead of nursing home, home instead of assisted living, home instead of having to move in with a family member in order to get the support that I need. So just the name itself speaks to choice. And we are a franchise. Home Instead Senior Care is the largest franchise network of home care, non-medical home care in the country, actually in the world. It's not just here in North America, but across. I believe we're in 19 countries now.
Wow.
So yeah, it started in Omaha, Nebraska, in 1994, and has grown into hundreds and hundreds of senior care, local senior care franchises across the globe.
Wow, that's amazing.
Yeah.
I know that we do this for my mom, and we have home health, home care for her around the clock now. We started off with just a few hours and things like that, and then we moved into where it's 24/7 now.
Yeah.
But how many people do you have working for you that are out in the field going to these jobs?
Great question. It varies. So, it can be anywhere between like 75 to 100 different employees at any given time being out in the field on any given day. So it's quite a lot of people. And I think that, it's both a blessing because it allows people, like I said, to receive care at home, but especially in the time of COVID, it's been, it has made it challenging and made us really think creatively about how to continue to communicate with and train consistently and make sure people feel like they're delivering and receiving this type of care in a safe way in the time of COVID.
So are you testing your employees daily, or how does that work?
Great question. We've come up with like a 4-part strategy to kind of keep people safe. I mean, it goes without saying that the number one thing is education and training, not just for the people who work with Home Instead, so they know what to do about infection control and proper use of we have our Home Instead masks.
Nice. Yeah.
And
see it. You're like, let's see
yeah,
it.
yeah, exactly. Did you see me modeling?
Nice.
That's great.
So, proper use of masks and PPE and infection control practices, but we oftentimes have to be the ongoing teacher for our clients and clients' families too, because a lot of our clients do have either mild to moderate dementia or Alzheimer's disease, different types of dementia, not just Alzheimer's. But it's hard to adopt and adapt to change so quickly like we've had to with COVID. And so not only do the people who caregive for Home Instead have to know what they're doing, but they have to really be patient and consistent and repetitive teachers about what to do and why, and do it in a way that makes it feel like this is just part of daily activity, all in a day's work, kind of the right thing to do. But that it's so I think that's the number one strategy we have, is just really, really, really thorough training for our team and teaching them how to then also be the trainer on the job in the client's home. I think we do, in addition to the PPE and that kind of thing that we issue, we also put in a system where every day that a caregiver goes to work, they have to check in with the office. And we do that through an online scheduling system. So at the time of getting their reminder that they have a shift tomorrow with a client, and at the time of when they're actually clocking in, they answer questions like, have you had an exposure to known exposure to COVID? Has someone in your household had a known exposure? Are you having any symptoms? Anybody in your house having symptoms? Have you traveled out of state on a plane? So we ask these questions repeatedly. If you have 6 client shifts a week, you're answering these questions 6 times.
Wow.
So, and that helps us stay in communication with how people are doing and wellness checks, if you will, even though they're not reporting to work at our office, they're reporting to work at a client's home.
Wow.
Yeah.
So,
So
Eric,
going back to your question too, Rafi, about testing, we have used testing quite strategically, I think, because I think there are moments in time where you have to make sure that someone is safe to go to someone's home, especially after a known exposure, after they've been traveling for out of state or on a plane or whatnot, where people had fears about that. So we do use COVID testing strategically. We've even had clients that say we'd like to start service with home instead, but we'd like the person to come with a recent test to start. And we haven't had any caregivers that were unwilling to do that. Be willing to show a test. So it's kind of our 4-part strategy.
Well, it sounds like you've had to do a lot more because of the virus. So before the virus,
Yeah.
it was probably a little bit more smooth sailing, where you would just assign people to the position, to the different jobs that would come up, right? Do you
Absolutely. Yeah. I know, the COVID has really changed. I mean, you can imagine we all heard on the news how these stories of, congregate living situations, whether it was a nursing home or a rehab center or an assisted living, where there were COVID breakouts there. And I think that made people feel more compelled to possibly choose one-on-one care in their home through an agency like Home Instead more often than maybe one of those other choices, just because of COVID. But that responsibility for us to make sure that we're bringing care to them in their home in a safe manner has been all-consuming for this year, and it should be. It should be all-consuming. If we're gonna send people to someone's home and care for them, we should be thinking constantly about how to continue to always do it as safely as possible. And so that I would say it's been the number one
priority,
worry, concern, absorber of our time this year.
That's great.
Yeah.
Eric,
So we do have a lot of people watching, and if anybody does want to ask questions, please do. We will put them up on the comments, and we're happy to answer any questions. You have a question for Eric or for Candance or myself, please put it up there. Candance, did you have a question that you wanted to ask Eric?
I did. Hello, Fern. Thanks for watching. So, Eric, as I think about, the clients that I serve that are seasoned, because
Yeah.
I'm very mindful of my word choices when I'm dealing with my seasoned.
Yeah.
So when I think about that, it's a very sensitive, discussion from time to time when you're dealing with early stages of dementia.
Yeah.
And other conditions that can impact someone's ability to stay in their home or to need your services. So what motivated you to get into the business of Home Instead? What was your motivating factor?
My career before Home Instead was in healthcare. I did a lot of work in the hospitals, kind of helping develop policies and patient and family advocacy kind of education in services, and so that kind of thing. And I really felt like when I finally got into healthcare, I didn't start there right away in my career. It came about not until I was about 31 years old that I kind of find myself taking my kind of marketing and account development background into the medical environment. And I really clicked with it. I felt really passionate about it. It felt more like a calling than a job. I felt there was that sense of advocacy in what I was doing. Mm-hmm. And my business partner, Diane Green, that I mentioned before, she's an RN. She and I got to know each other working for the same healthcare company, and our two departments had to work very, very closely to deliver services. And again, they were hospital-based services. So it was about 10 years into our tenure working together when she said to me, "Would you ever want to continue working together but be our own bosses?" And I said, I've kind of in the back of my mind thought about owning my own company at one time or another. And she's handed me some information or an article about a businesswoman who had changed careers and bought a Home Instead franchise. And so she and I started researching this, and we realized how much it really dovetailed well into like our passions and the career experience we had to continue to deliver a home-based service, even though we've been working in the hospital. This kind of idea of delivering a patient and family-centered care service really was kind of what we were passionate about doing and experienced doing already. So we started researching it, and a year later, we owned Home Instead.
Yeah, that's awesome. My mom was a registered nurse, and she worked at different convalescent homes and various hospitals as she went from a hospital into the registry. And I couldn't wait a lot of nights for her to come home so she could tell me the stories about the patients that she was caring for and the various things. And so I know when I was in high school, to work in a convalescent home and work with the seniors, it's a care of love and compassion when you're working with our seasoned members of the community. So it's great to hear that you had that background, and then your partner did, and you guys bridged it together, and now it's something that you can do with compassion.
It's true. I mean, the more we do this, the longer we've done this, the more you realize that that the relationship is everything, you know, and we talk about that at Home Instead a lot when we're hiring people and we're interviewing people and we're going through training. You know, you can teach somebody a skill set that they don't have. You can teach somebody what it's like to help someone transfer from bed to wheelchair or from wheelchair, you know, into shower and back. And those are physical skills. You can't. It's very hard to teach somebody, you know, the heart of caregiving, the compassion of caregiving, that sense of advocacy, the feeling you get when you really helped somebody not just get through their day in the mechanics of it, but you brought relationship to them. And a lot of our clients don't have a lot of that, you know, beyond what we bring to them. So if we're not bringing that, you know, consistently and in a measurable, meaningful way, then we're missing a big opportunity. So that kind of relationship before task and really having that passion for connecting with the person is a huge part of what we do.
Yeah, and it's so wonderful to know that your services exist, and they're such a large scale now, because a lot of my friends, I've watched them care for their parents, and you know, they were very concerned with the level of care that their parents would receive. So they did a lot of it because they had that compassion and they wanted to care for them.
Yeah.
But it also took a toll on them, you know, mentally, physically, to be in that situation, because again, they're not trained in it. But yet, you know, caring for your parent, you know, as you mentioned, Rafia, is something that it's very sensitive, and it escalates over time. You know, it tends to escalate in terms of the amount of care that they have. So to know,
plus you're limited, you know, like it's better to call somebody like Eric and have somebody who is more qualified to do certain things. And you know, we can be compassionate and all of that, but some of our knowledge of, you know, healthcare
to do it.
Yeah, we don't have that. So
that's so true. I think, you know, the best situation is where the family caregivers and the professional caregivers from Home Instead create this collaboration, or, you know, not to use these like isms that, you know, these like cliches that we use in the business world, but I think it's true. I mean, you need a team of people, especially in, you know, Rafia, you gave the example of going from a little bit of care to around the clock care over time in your family. And I think, you know, recognizing that in order to make that happen, everybody needs downtime. Everybody has to recharge their battery. So there's like the spiritual and emotional like downtime someone needs, but also, you know, a professional caregiver may bring experience or a technique that they can share with everybody on the team, both families and other people on the professional caregiving team, that just makes everybody's life easier and makes care safer, and the daily routine feel a little bit less effortful for the person receiving the care too. And so, you know, as professional caregivers, we learn so much from what the families have to share with us, and hopefully we give that right back to them, and it becomes this sort of everybody's benefiting from working together.
We had somebody there for 5 years that was, you know, consistent.
Wow, that's fantastic.
Yeah, and we just switched over because some of our care has changed, but we have 2 per week that
Yeah.
alternate because they can't do, of course, 24/7 for some, So we have 2, and we need to be able to communicate. We need to be able to talk to them. We need to be, able to reach out, and they need to reach out and tell us what's changed and what's going on. So those
Yeah.
are all very important factors when you're getting somebody.
Yeah, it's funny you bring up the communication part of it, Rafia, because we that has been another thing in our world that changed a lot in COVID. We were when we start service with any family, it's much more than just introducing a caregiver or caregivers and then us walking away. I mean, we stay very hands-on, and we're doing regular phone calls and site visits typically to check in with the family and the person receiving the care and the caregivers themselves. And we create this constant loop of communication with everybody to make sure that things are going well, and are there any things we need to add to the care plan. And in the time of COVID, that on-site, going to the home and visiting and that kind of thing, we needed to really be careful that we weren't doing those things extraneously, that we were only going and creating another level of exposure to another person if it was absolutely necessary. And so we've had to use technology a lot more. And we were fortunate that before COVID started, we had been adopted this sort of care plan or structure called integrated care, which is kind of a combination of in-person and technology-based touch points. And so we've been using tablets, a modified home instead customized GrandPad, which is looks like an iPad or a tablet or whatnot, that our client care coordinators can check in on the client and check in on the caregiver, not just through a phone call, but like using a video screen and checking in on them. And the caregiver can give our client care coordinator a tour around the house and say, hey, here's what modification we did to help make it easier to get in and out of the bathroom or whatnot. And our client care coordinator can advise and instruct and document all virtually, because the camera adds such a sense of presence that we wouldn't get if we were just making a phone call. So we were really grateful that we'd already started the integrated care prior to COVID, because we really, really, really needed to use it a lot.
Good.
Wow.
So Eric, how is there indicators that folks that are listening or will watch later in terms of when do they seek out your services, or how do they find or how do they identify the need for your services? And is that something you have, like maybe a checklist, or if they're at this point, how do they know that they need home instead care?
That's such a great question, and I have to say that I don't know if there's a one size fits all answer to that. The best thing you can do is start the conversation and process early. And when I say start the conversation, it's actually multiple conversations. It's the conversation within your own family with the person who may be needing care in the near future, with, if it's, a bunch of siblings worried about mom or dad or both, maybe those siblings coming together and say, hey, let's just talk about this, so we're not caught off guard. But reaching out to a service like Home Instead and asking for resources about how to start these conversations, questions that we can bring up in the conversation. We have a lot of resources that we can give to families who want to start having these conversations amongst themselves. And then we can also send resources to you about what you can expect if you were to have Home Instead, for instance, come out and actually talk to your family in what we call a care consultation. What does that look like? What information would you gather? How would you help guide us toward, do we need a little bit of care, a lot of care? Even talking about that idea, working side by side between family caregivers and professional caregivers. What is the how do we share that And that looks very different from one family to the next. So it's, I'm reticent to sort of give a one size fits all answer to that, but you can't start the conversation too early or gather resources too early. And you could either call our office or go to our website and probably find some information that would at least make you feel a little more ready for those conversations than you might feel now.
Mm-hmm. So we've been talking about parent care, but I'm looking at it across the board. So it could be a parent, it could be a spouse, it could be a sibling.
Mm-hmm.
You know, I'm sure you have varying clients that you work with.
That's such a good question. I think because I'm the age I am, I turned 50 this month. So I think of the perspective of like planning for care for my own parents. So I oftentimes phrase it that way.
Mm-hmm.
But the people who call or email us or inquire about services, sometimes it's the person needing care reaching out for themselves, self-advocating. I think I'm ready for this. I'm going to need this because I'm having a procedure next month, or I decided to give up driving, but I still want to be able to get out to do some things out of my own house and don't want to give up that part of my life. So people, sometimes it's the individual themselves reaching out to us. Sometimes it is someone who's calling on behalf of a parent. Sometimes, like you said, Candance, it's a spouse. So it can be a grandchild advocating for a grandparent or a niece or nephew, or someone advocating for an in-law. So the initial point of contact that we have with the family can be any of those or many others too. So it really varies a lot.
So if somebody was like going through cancer treatment, for example,
yeah,
that would be, if young or old, or it wouldn't matter. They could forcibly, see getting some help from you, even on the days that they needed it, not full time maybe, but just around the times when they were having treatment.
I'm so glad that you brought that up, Rafia, because as of January 1, we're changing our name. We're changing it to just Home Instead, and we're taking the senior care off the official name, not because we're changing our service, but because senior care does not reflect everybody that we serve. Okay. And I also think that the term senior is changing, and I think Candance, you sort of inferred that a little bit too, in that, people respond to nomenclature differently, and they, senior or seasoned or aging adult or whatnot. I think being sensitive to the fact that how people self-identify is important. And so we decided that because we care for adults of all ages, we're licensed home care agency, and we're able to care for anybody who's 18 or over as an adult. And we have clients who are in their 30s and 40s and 50s that, either on a short-term basis or on an ongoing basis, need support with their activities of daily living at home, and are nowhere near identifying with the term senior. So we decided to take the senior care out of our official name, not to be exclusive of seniors, but to be inclusive of everybody else that we are serving.
Looks like we have a question from the audience. Rafia, you want to shoot that one?
It says, what impact have you seen the pandemic have towards family engagement in the senior care process?
Oh gosh, I'll try not to make this answer a 4-hour answer, but it's a great question, a really good question, because it has. It would be not a surprise to hear that the way people engage our services is with a lot more caution. A lot more questions around our safety protocols, what they can expect from us as far as training, like I said earlier, monitoring of caregivers, how we use testing. So you can only expect that people are going to have those questions. I also think there are people who never thought they would use a service like ours prior to the pandemic that are finding themselves inquiring about Home Instead because maybe they were leaning more toward moving into an assisted living, or maybe they had been living in an assisted living and the family decided temporarily that for the time being to move them home because they were afraid of the spread of COVID in a congregate living situation. So I think there are people who almost came to home care and senior care a bit reluctantly, or is that wasn't our first choice necessarily, but now it's our first choice in the time of COVID. So in those situations, we just want to make sure that we really answer people's questions and not take for granted that the answers one family is looking for is the same as another, because there isn't a one size fits all. It has to be very, very customized. And we also find ourselves having to be the teacher. Like I said earlier, the caregivers really teach a lot about safety in the time of COVID, because the client's home is their workplace and they want to feel safe in that workplace. And so assuming that every family has the same level of rigor and consistency with how they do infection control and safety, a lot of times the caregivers will remind certain family members, hey, you might want to try this. This is what we're using, or this is how frequently we're wiping down doorknobs or light switches and faucets and so on. If you want to adopt this when we're not here and you're the one providing the care, then we can be consistent. So there's a lot of idea sharing that's happening between us and families in that regard too.
Wonderful.
I hope that answers, at least partially answers that big question.
So I have some more questions from the audience over here. I have one from Heather, and it says, I may have missed this, but does Homestead work with families who want to have combined care, where they come in a few days a week with the family providing care the other days? Which we've answered that.
Great question, yeah.
And then the other question was, is Home Instead available in other states?
Yeah, the first question, yeah, this is a very customizable service. So you can have a lot of care, a few round the clock care, or you can just use our service a few days a week for errands or shopping, or some people like, I only need to bathe or shower 3 days a week. So, and that's the most kind of like risky part of my routine. So if someone can help me with that, I'm safe being by myself other hours of the day. So hope that answers the first question. And then as far as the second question goes, in other states, yes, Home Instead, if you do a Google search for Home Instead and in the city and state where you are looking for services like this, you will find listings in your area. And certainly in more densely populated areas like LA County, I think there's 16 total Home Instead franchises just in LA County alone.
Wow.
So, there's kind of one in every neighborhood in a really densely populated place like LA, but in more rural parts of the country, you'll still find Home Instead. They may be a larger franchise territory that they're serving because of it's less densely populated, but you'll find services.
So there's another question, Eric. You're getting a lot of questions here. So it says, what is the main silver lining your business has discovered during the pandemic?
Well, we knew this already, but it's just been more glaringly obvious, is that caregivers are superheroes. I mean, they are amazing people. I mean, when you think about the things we've been going through with COVID, and the idea of essential services, I mean, we fall into that essential service category. And so, just because we're essential to a client doesn't mean that caregivers don't feel that same sense of worry and risk for themselves and their own families going to work every day. And we certainly, I just want to, I can't applaud the actual caregivers enough, because they're the ones showing up every day, showing up when families can't because they're too far away, or maybe the families that normally visit are quarantining because of their own job puts them at a little bit more risk, and they want to bring home to mom or dad or grandma or grandpa. So I just have to say the caregivers are the silver lining of all this, because not only have they turned on a dime and adapted to this, but they've done it in a way that has, I think, helped bring down anxiety for clients and families by reminding them that this is doable. We can be methodical about being safe. And while nothing is 100% effective as far as preventing COVID, there's a lot we can do to keep ourselves safe, and also to keep ourselves mentally and emotionally up during all this time. And caregivers, they do all of that. And I'm so impressed by the renewed energy they bring to this kind of work every day.
Yes, absolutely. I have the same person that asked the last question said that they didn't see anywhere that they were looking for the franchise. So they're hoping that there's going to be more in the future.
You know, what I would say is if anybody's looking for a home instead out there in a different part of the country or a different part of the state, and they're having a hard time finding it, call our office. I mean, we refer people who call our office to other services outside of what, outside of here in Culver City, Inglewood, and the neighboring parts of LA that our office covers. Call us. We're happy to help connect you with services. And even if you are looking for something that isn't home care related, but kind of is a neighboring type of service, like I need someone to help me find an assisted living or whatnot. If we don't do that, we're well connected to the other type of services and ancillary services that do that, and we're happy to make the right referral.
So the people that you service is within Culver City, Inglewood, and I forgot where else you said.
Yeah, so our office is right on Slauson. So we're right on the border between Culver City and Ladera Heights. And our franchise territory is really kind of Culver City, Inglewood, Ladera Heights, View Park, Baldwin. So all the neighboring neighborhoods of LA that kind of adjoin to Inglewood and Culver City. Let's see, the Palms area, Beverlywood, Cheviot Hills. So all these neighborhoods that are kind of, part of LA, but are well known to us as like local neighborhoods. We serve those areas. And if you were to call our office and your need was outside of our service area, we know all the local homestead owners around us. So we would connect you. It would be a very warm transfer, if you will, or warm introduction to the neighboring service, because it helps to be with the homestead closest to you, because the caregivers that work with that franchise also live in the area. And so it's, caregivers want to work close to home, and makes it easier for them to go to clients and integrate work and life for them too. So it does help to be with a home instead that's closest to you.
Makes sense.
Yeah.
But if I was looking for something in Las Vegas or Arizona or something, you could probably connect me to somebody else.
If for some reason you did a search and you looked for home instead Las Vegas and you weren't really finding what you were looking for, you could always call us and we would help.
Great to know. That's great information.
Sure. Believe it or not, are past the half hour, Eric. You have given us so much great information.
It goes by so fast.
It does, doesn't it?
Yeah. It really, really does.
So one of the things that we like to do here, Eric, is talk about our motivation for the week. And so we talked about a little bit of what motivated you to start your business. So do you want to tell us what, if you do set motivations for yourself for a weekly basis, what would that look like for today, for this week?
Oh gosh, I might sound a little bit too hokey, I guess, but I think my motivation and has always been, even before COVID, was just a reminder to show up and be present. Our work is with people. It's the work of human interaction and human touch, if you will. And so that means that every day is different in the very, very best of ways, but also in like the most stressful of ways. And so I think, as my way of sort of motivating myself is just to remember, like, to show up for what comes your way today. Because we all go into the day with our list of things we want to do, or I'm going to hit this goal by the end of this month, or I'm going to do this many things by the end of the month, whether it's Candance walking or.
She's a great example.
Yeah. Or whether it's an exercise related thing, or I'm going to eat healthy or whatnot. I think that the thing that in our world that I try to stay motivated by and for is the unknown, the thing that I can't put on a list, that's coming my way, whether I want it to or not, or plan for it or not. And what does it look like to be present for that? And I think that is a necessity in our world. But if you think about it and motivate for it as if and not take it as like, this threw me off my game, but like that is what I do. That's what I exist for, is to be that kind of responsive type of service and not be flustered by that, but more like it's because that kind of unforeseen need that falls into your lap unexpected each morning is the very reason why we exist, is to help people, to be a resource for that problem and be a problem solver for people. And I like that part of my day. It's even when it's stressful, I like feeling like I helped solve that problem. And I that's kind of what motivates me.
What a great answer. I love it. It's almost like saying you're just being mindful to whatever's coming, you know?
Yeah, I think that's a good word. I like that word a lot too.
Mm-hmm. So Candance, before I ask you the same question, do you want to talk a little bit about what's going on in the chamber this week?
Sure. There's a discussion that I'm really looking forward to as a small business owner, and the time that we're in, which is coming up at 2:30. It's our biweekly COVID-19 roundtable discussion, and the chief of police will be there today sharing some information that small business owners or business owners need to be mindful of. And that's going to happen today at 2:30. It's virtual, and it's generally about maybe 30 minutes or so. So again, hopefully you guys have had a chance to sign up for that. And outside of that, I don't think we have anything else happening this week. The combo with the mayor, I think, has been moved or postponed. We're not having it this week. So those are the things that I know. Combo with the mayor, actually, it is happening on the 6th. So Friday, the great discussion. Mayor Jörn Erickson always shares openly and very candidly what's happening in our city. And he's really given some great insight, especially during this time. So it is happening this Friday at 5 p.m. Again, go to the Culver City Chamber website, click on events, and you'll see all of the events that are happening this week and the weeks to come. So,
and even though it's not a chamber event, get out and vote. That's tomorrow.
Yay, civic duty.
And you do not have to be a chamber member to attend any of the events that we've mentioned. It's open to the public.
Right, great. So Candance, you've been doing a lot this week. I have been watching you.
Yes.
All that walking, all that
Yes.
motivation that you've got. Is there some motivation left for business?
You know, I have, I've been walking 101 days into my birthday, which is Thursday. It's my birth anniversary. And I've had help from my friends. I could not have gotten this far along because there are days I would not have gone walking had I not had a walking buddy. So today, my motivating factor, I heard a really great message yesterday, and it was about focusing on compassion. So this week, I'm going to be checking my compassion and just making sure that I am not passing by things because of the current situation or individuals and not feeling some level of compassion. I think there's a lot of things that we get conditioned to over a period of time because you see them so much that you just say, oh, that's a scam or this is that, but really acknowledging the fact that this is a human being, regardless of what the situation they may have fallen on. They wouldn't be out here scamming if there wasn't a condition. So looking more to the situation and finding ways to not put myself in harm's way, but to at least be more compassionate and not letting it, gloss over in my eyesight. This last week, I asked 101 of my clients' family members to make a purchase during the week to help me celebrate my birthday in lieu of gifts for me. 71 folks have done that.
Wow, congratulations. That's awesome.
Yes. And I got messages saying, hey, I couldn't get the link, so we extended it to today. So we are 30 shy of our 101. And whether we hit it or not, it's just an honor that the 71 folks found a way to come out and support the celebration. So again, my focus is on compassion, and I have so many reasons to be more compassionate, because I see it in my clients that show up for me on a regular.
That's awesome. That's great.
Yeah.
I love it. You know, I have to say, Kenneth, you encapsulate, I think, a lot of things that people are feeling. Like you take all those feelings and those things that we, the best of ourselves, and more than most people I know, you find a way to make them actionable. So I just have to you inspire me. So it's I love hearing how thoughtful you are with all of the things that you do, both personally and professionally.
Thank you.
Absolutely.
I do have a great sense of humor that I'm finding out folks don't appreciate. Tell me what I did offline.
I appreciate.
Well, I didn't say everyone, but some folks don't. I'll tell you what I did offline, but it wasn't nice. It was funny, but it wasn't.
I want to hear too.
Oh, that's great. So my
Rafia.
motivation for this week is, since yesterday was November 1st, I am starting the Thankful Month. So
Nice.
30 days of challenge that I'm putting for my Culver City Kind group. 30 days, list your gratitude, tell me something that you're thankful for. Hopefully we can collect a lot of gratitude in this month. And so we're already 29 days, away from that. So I started that off yesterday, and I'm really excited for that. And then Jim Clark, who pretty much, was the leader of this whole Culver City Kind movement and declared our city a kind city. This month on November 13th, we have World Kindness Day. So he has put together a proclamation that he's presenting to the city for that. And we're going to invite our other sister cities throughout the world to come join us in that. So I'm excited about that. And that's what's motivating me this week.
Awesome. So the collecting of the kind thoughts, are we putting it on the kind group?
Yes.
Okay, perfect.
Yeah,
Okay.
I post every day. And so, put all your thankfulness that you have and your gratitude that you have. Nothing better than giving thanks for every little bit of everything. That's how I look at it. So.
Hey, Rafia, I love that. Will you repeat where someone goes to participate?
Sure. I have a Facebook group called Culver City Kind, and you can find it. We have about 2,700 members on there. And we also have a Instagram page of that as well. But the Facebook one is more interactive. More people seems to, want to interact there. So that's where I've been posting. I post on both, but go ahead and go on there, ask to join. And then once you join, you can post, you can comment, you can like, you can do all kinds of things. So I'm hoping that this whole month of November, we can give a lot of gratitude.
It's a great month to express gratitude.
Absolutely.
Amen.
Absolutely. So it's Culver City Kind, #CCKind. And go over there and find it. It'll be great. Eric, you have been a wonderful guest.
Yes.
We so appreciate you coming on. We had a lot of interaction today with you, and lots of questions and things. So that's wonderful.
Thank you for inviting me. What a fun thing to do, and a great way to start the week on a Monday. So I really appreciate the opportunity, and always fun to talk to both of you.
Thank you. And if there's any business owners that want to come join us for a conversation, please contact either myself or Candance, and we're happy to host you here as our guest.
Yes. There's one more thing that we're doing here in Culver City. It's called the Tribute to Our Heroes. Heroes. And that's November 11th. Flags are available and they're on sale. You can go to culvercontribute.org to purchase your flag. It was so amazing last year. I thought they were going to be small flags, but they were really tall flags with the heroes that you were honoring. They could either have passed on, or they can be someone that's currently, living that you just want to pay tribute to. So again, go to culvertribute.org to purchase your flag.
Wonderful. That's an Exchange Club event that's happening. This is the second year. Last year was the first year that it was put into effect. So It's going to be a nice event. And 100% of all of that goes to the veterans.
Awesome.
I love that.
All right. So, Rafia, you want to take us home? Take us out.
Thank you. I've had a lot of fun today. I hope you all did too. It's a great way to start the month of November off. And thank you, Eric, again. And if anybody has any questions for Eric, please put him on here. We're happy to answer questions later. And you can contact Eric at Home Instead Senior Care. And Candance from All That and More Boutique, happy early birthday to you, my friend.
Thank you.
And I wish I could hug you and celebrate with you. But you know I'm sending you big hugs.
Yes, yes. Don't send me any chocolate chip cookies because you know I will eat all of them.
How about a chocolate chip cake?
Well, now, huh? How about a slice?
Happy birthday.
Thank you. Thank you.
Happy birthday.
Thanks
Thank you, everyone, for watching.
Bye.
Bye.